So as people start to trickle in, I would love it if you said hello in the chat. Hi. And please actually post a message saying, on a scale of 1 to 10, and 10 being, you know, super big nerd, how knowledgeable are you with PCOS right now? You know, because some folks are coming in and they, you know, they may have a diagnosis of PCOS and they're wondering how to help themselves. Other people, you know, just know people, maybe their partners have PCOS. Ooh, okay, cool. We got one coming in.
Yeah.
8 to 9, Liz. Wow.
That's
okay,
awesome.
you're a genius. So you can take over now.
Hi, Liz. Thanks for coming.
Amazing. Taylor says 6 out of 10. Amanda says 3. All right.
So we do have
Good
a
gauge.
Yeah.
Yeah. Big range. All right. Well, maybe we'll allow for maybe 2 more minutes for folks to trickle in. And if not, they can always get the replay, which will be sent out tomorrow for folks who can't make it live tonight.
Settle in, everyone. I have a little tea with me, although I didn't steep it properly. So there's little herb particles floating around in it.
Classic naturopath. Classic. Liz says, hi, Arlene. No, still so much to know. Haven't tackled it all yet.
Well, that's what we're here for, I guess. I hope.
Yeah, folks. I'm so excited for this. Yeehaw!
And like we're loving your background with the yellow and the crown.
On brand.
And my disappearing hand because of the green background. Oh, and Vita says, okay. Oh, she means 1 to 2. Super new to it. All right. Nice. Okay. No worries. And where's everyone coming in from? Where are you tuning in? We are all here. Dr. Arlene, Dr. Suki, and I are here in Toronto. I see some familiar names, so I'm assuming a couple people are here from Toronto. Okay, we got another Toronto. Okay, cool. Couple Torontos. All right. T-Dot. That's amazing. Okay, well, it looks like, you know, it's 6:05 in the spirit of punctuality, which if you don't know me, I am pretty punctual. So let's start. Why not?
We're ready.
Perfect. Okay, so I'm going to give you folks a little bit of an outline. First of all, thanks so much for coming, for joining us. I'm really, really excited to host this webinar on behalf of Kween Wellness. And if for folks who don't know, Kween Wellness has really started to blow up in the past couple of weeks, couple of months. We are trying as much as we can to get as many healthcare practitioners on board onto our network. Healthcare practitioners that are constantly seeking ways to educate their patients, the general public, and healthcare practitioners in general that have basically committed to being anti-racist, because that is a really good thing, especially during this climate, this political climate, the social climate. And I think more and more patients are looking for practitioners who are actively anti-racist and doing some good work in that area. So I'm happy to host Dr. Arlene and Dr. Suki here today. Thank you so much for coming on.
Thank you for having us.
First of all, I guess I can say that both of you, both Dr. Arlene Dubier and Dr. Suki Hon, are actually working out of the herbal clinic and dispensary here in Toronto. So that's on the west side in Roncy, for anybody who's familiar with Toronto. And you folks have both been working in that clinic for a few months now, right?
I think like that clinic specifically does have like a very welcoming and community vibe, which does make a lot of patients more comfortable coming in. So I really like that aspect of it.
Totally.
Exactly.
Yeah. That's a similar vibe that I got from it. And I'm sure as all of us have visited, we've gotten that you just feel comfortable when you enter the space. So I think that's a wonderful healing environment.
Of course. Yeah, for sure. And I know,
again,
sorry,
Subtle plug.
Of course, why not? And so that is the Herbal Clinic and Dispensary on the west side of Toronto. Dr. Suki, we've actually hosted you once before here on Kween Wellness. Mm-hmm. Happy to have you back. And I love your whole vibe on being a conscious advocate and being a conscious kind of educator for patients and for helping patients kind of educate themselves. And that's one thing I really, really like about you. And Dr. Arlene, I love that you just, well, actually, no, you didn't finish it recently. You are a birth doula, right? For the past little bit.
Yes, ma'am.
Yeah. Mm-hmm. So Dr. Arlene's been a birth doula. Both are naturopathic doctors in good standing here in Ontario. So happy to have you folks here on the very first webinar that we're doing. So I love it. So for everybody who's listening, thanks again for coming in. I'm just going to give a brief kind of outline of what we're doing tonight. So you can expect that we're also going to give a brief background on, in general, what PCOS is, polycystic ovarian syndrome. Of course, we're going to get to debunking some myths around the topic, and praise be, because we got a lot of myths in here about PCOS, which a lot of the general public don't know. So I'm happy that we're finally getting down to those. We're also going to be basically teaching you folks what you can do today, or what you are doing today that may be contributing to your PCOS diagnosis, either helping or hindering. Some lifestyle habits, some nutrition, some basics to help you have a better outcome with PCOS. Any other support that naturopathic doctors can offer. And we'll definitely have a space at the end for questions, but we're going to try and use the poll configuration. So just below the chat, there's a thing called polls. There's nothing in there right now, but I will hope to put some polls up as we go so that we can get a lot of audience engagement here and make this more of a conversation than a lecture. And of course, like I mentioned, please stay tuned till the end. We're going to give you a little bonus for you folks to kind of take home, even though I know you're already home, with some take home reading. And also, we're going to be sending out the replay again of this webinar tomorrow. So don't fret if you can't make it, or if you have to leave early or anything else. If you know a friend that signed up but couldn't make it here live, we do have the replay coming for you in the next 24 hours. Okay, so yeah, I guess doctors, I'll let you take it away. Give us some background on PCOS.
Amazing. Well, thank you so much for the introduction. So I will be speaking first briefly about the background and kind of just the gist of what PCOS is. So like Erin has mentioned, there are a lot of myths and misconceptions around the diagnosis. So what we did for this webinar in preparation for it was that we actually went to Dr. Google and took notes on what were some of the most common questions asked or searched in Google. So we're going to be debunking some of that. But obviously, before going into that, just a brief background of what PCOS is. So like Erin mentioned, polycystic ovarian syndrome. So when people think of this diagnosis, we think about having irregular periods or like having what we call cysts on our ovaries and things like that. But medically speaking, what PCOS is it's a hormonal disorder commonly seen in women during their reproductive age. Although we know that it's due to hormonal imbalance, we're not quite sure exactly why that is. So that's something we will be touching on later on as well. And with this diagnosis, it's actually what we call a diagnosis of exclusion. So what this means is that we have to rule out everything else or like every other possible diagnosis before we can say it's like, okay, you might have PCOS. So this in itself can be a little tricky because it can lead to a lot of misdiagnoses, which again, we will talk a little later on while we are debunking some of the myths. So yeah, that's kind of like the medical definition of what PCOS is.
And I can imagine, Dr. Suki, just if I could interject, that you know, a diagnosis of exclusion is exactly that. So it's almost evident, you know, almost necessary that it gets diagnosed with something else first, right? And that's the case with so many people.
Yeah, exactly. And it's like very easy for someone to just jump to conclusions like, okay, you have PCOS, but have you ruled out everything else? It depends on who's doing the diagnosing, right? So with that being said, there is a criteria for the diagnoses, and this includes the following. So we would require 2 out of the 3 criteria for us to be able to say, hey, you may have PCOS. So the first one is called amenorrhea or oligomenorrhea, meaning that you have irregular periods in a way that you do not have a period for about 3 months, or a cycle that is longer than 35 days, or it can be regular cycles, but you're missing maybe like for a month or like 2, and then it comes back regularly. So it's a little bit more general that way, but in essence, this is where the irregular period criteria comes from. Secondly, we call it hyperandrogenism, which means that we have higher androgens or male hormones. So this can either manifest through lab work or through clinical or symptoms of higher androgens. So some of those symptoms include acne, very oily skin, hair loss, hair growth on the chin, or on the abdomen, inner thighs, or even around the nipple area. So those are some signs of higher androgens. And then lastly, the third criteria is where the polycystic ovaries come in. So with that being said, it's interesting because the criteria for polycystic ovaries include more than 12 cysts you find on the ovaries. So like if you have like maybe a couple of them that's less than 12, you may not even actually qualify for that criteria, which I thought was interesting. So this is usually found through transvaginal ultrasound. So with those 3 criteria, you only need 2 of the 3 to be diagnosed for PCOS. That was a lot of information.
It is really good info. Thank you.
Yeah. So we will be touching on some of the myths that kind of like correlate with the criteria a little bit, because it can get confusing there. But before we even move on to the next topic of like what may contribute to your PCOS based off of like what you're doing today during like modern living, I think it is interesting to note that with PCOS, there's actually a lot of associations and correlations with things that they're still related to hormones, but like not something that you would think of immediately. So with PCOS, it's commonly linked to like inflammation, insulin resistance, right? And insulin resistance is kind of something you think of when you think of diabetes. So that's something to keep in mind, because that plays a huge role with how naturopathic doctors approach certain treatments or recommendations around the diagnoses. So with that association, individuals with PCOS are actually at a higher risk of diabetes and obesity, or dyslipidemia, and other things such as like hypertension, even gestational diabetes, so meaning diabetes during pregnancy, and like cardiovascular disease. So there's a lot of associations with other conditions as well, and that's why we think it's important to address PCOS as a diagnosis, not only on PCOS, but also along with all the risk factors that may be involved.
Right. And the risk factors are really key information for patients who potentially have PCOS or even have a family history, right?
Mhm.
But tell me, there has to be like some silver lining, maybe.
Yeah, so it's
Is there?
interesting because with the hormonal dysregulation, most of the time estrogen is being unopposed. So what that might mean is that you may have better bone density in the future. So it's like, I guess, a decreased risk with osteoporosis. You may have the potential of having a later menopause or have like later fertility because you do have more follicles on your ovaries that allow for that. So obviously, all this being said, in terms of the associations, the risk factors, and like the silver lining of it all, is assuming that, you know, like PCOS is not being managed properly. But if it is, then we can mitigate those risks. We can decrease that. And hopefully help you manage all the symptoms that you may be experiencing with the diagnoses as well.
Amazing. Yeah, that's something that people really need to know, right? Dr. Arlene, can you tell us maybe a little bit more about what the folks out there may be doing to contribute to their own PCOS?
Yeah, that's a pretty solid question. And I'm glad that Suki was able to touch on, even though there are these potential risks later on in terms of your diagnoses, there are things that we can do. And of course, each individual is different. So you might not necessarily have those same risk factors in the future as somebody else with PCOS would. So in terms of what we might be doing now that could contribute to our diagnosis of PCOS is a lot in terms of our lifestyle and diet. So in terms of diet, we see, so how Suki mentioned that you might have poor blood sugar regulation. It's important to keep in mind that the foods that you're eating should not necessarily be those foods that are high insulin producing. So that would be foods such as dairy products, red meat, and simple carbohydrates. So those are forms of carbohydrates that break down faster into sugar. So that could be things like pastas, breads, all the tasty stuff, baked treats, as we know, sadly, not so good for us with PCOS. Aside from that, even our cooking practices could affect how much inflammation is built up in the body. So there's something called advanced glycation end products, and those are formed with certain cooking practices such as broiling, barbecuing, just extreme high heat. And that actually damages the nutrients in our foods and can promote further inflammation. And in PCOS, we see that individuals can have generally higher levels of inflammation. So we want to try to cut that down where we can.
So no barbecue.
No barbecues. No barbecues with our donuts afterwards, sadly. Yeah, so that's, I mean, of course, now that you mentioned barbecuing, if you put some good anti-inflammatory herbs in there, that would be great. We've all learned about that, like sage, thyme, all that good stuff. Definitely could help mitigate some of those advanced glycation end products that we see. Also, I hope that a lot of us have heard of the Dirty Dozen. So those are the top 12 foods that are most likely to be contaminated with pesticides. And these pesticides can affect our hormones. So I'm going to be talking a little bit more about this later. And Suki will also be talking about this a little bit later. But yeah, so focusing on good quality foods and trying to reduce our environmental toxic load as much as we can. So through eating those organic foods that are most likely to be seen contaminated with pesticides, and even through some products that we use. So that could be in our self-care products, our home products, and using plastics. So BPA in plastics can also contribute to dysregulation of hormones, which is why we often like to switch to glassware. And last but not least, I actually did want to touch on under eating. because that is a huge thing, especially for people with lean PCOS. We often see folks can sometimes cut calories just because you're not finding what works for you. And for example, if you're eating something that contributes to your acne, we just see that you can start cutting out things where you don't necessarily need to. So under eating and caloric restriction can sometimes affect some of us who don't necessarily need to cut down on our calories.
Mm-hmm. And so just to interject there, by lean PCOS, you mean people who probably aren't the kind of typical overweight PCOS?
Correct. Yeah. So that is one of often lean PCOS is underdiagnosed because we tend to see that normal PCOS as people who are slightly overweight or have difficulty losing weight.
Mm.
Yeah.
Wow. Thanks for that. So now I'm going to go throw out all my Tupperware. And
I know it sounds scary, but we can, at least being aware of it, right? Like we don't have to go throw out our Tupperware tonight, but knowing that this might be something that contributes.
Yeah, I know for sure, especially when you're heating up foods, at least, take the food out of the plastic. If you have to microwave it, put it on a plate or something.
Yes.
Yeah. I'm just going to do another subtle plug there as well. So every other Thursday, I do make an Instagram post on basically environmental and health tips on how we can benefit our health and the environment. And I do cover plastics a lot. And one of the things, like you mentioned, was like replacing plastic Tupperware with glass, or avoiding heating plastic Tupperware, or even storing fatty foods in plastic, because those tend to absorb the chemicals basically in the plastic way more than if you were to store something that was non-fatty. So I just wanted to toss that in there.
Yes.
Sure. Yeah. And I don't know, I think we're going to leave questions till the end, but I did just get a question about lean PCOS. I'm not sure if you guys want to answer it now or later.
Let's take a look. So it looks like it's from Miriam. Her question is lean PCOS also for people who are slim but carry excess weight in the stomach?
You know what? That is a great question, because I think it depends on how much excess weight we're talking, because usually people who are lean PCOS are in that BMI that's like the normal to under range. I'm not sure if Dr. Suki, you have a different answer.
No, I think what you said makes sense. I think what we mean by lean PCOS is just generally you look at someone, they look lean, and they have PCOS. I don't think it really qualifies as like, oh, they have like excess weight here or there. So yeah, it's kind of like more general, like overview. Yep, you look lean, you have PCOS, so you'll be lean PCOS. There really isn't a criteria, at least just yet, for that.
Right.
Yeah, that's a great question, Miriam. I think what the doctors are saying is basically that lean PCOS isn't actually a diagnosis. It's just like PCOS is the diagnosis, and it's less common in people who are quote unquote skinny. So people don't often get diagnosed with PCOS who are leaner than maybe people who do carry excess weight in their stomach. Like, great question. Yeah. Is there anything else, Dr. Arlene, that, people do? You mentioned undereating, which is probably a really big one. Anything else that they do, maybe like bad habits or anything like that you?
Yeah. I was going to touch on coffee and caffeine a little bit. I know it's a hot topic, and there are very mixed reviews in terms of coffee, and I see you cringing because you love it so much. And the answer to is coffee bad for you is it depends. And it depends on how you metabolize it. So if you're someone who drinks or just has a sniff of coffee and is immediately anxious and jittery, then that probably is an indication that you don't metabolize it well, and it might be contributing to further inflammation in your body. But if you could drink a coffee at 7 p.m. and it goes like it doesn't affect you, you can sleep peacefully at night, then you likely are a fast metabolizer, and it could actually be beneficial for you. Aside from coffee, if you are someone who works out intensely or is training for a marathon or something like that, and you're working out and it makes you feel exhausted after you work out, that likely is something that could also be causing further inflammation that perhaps you don't necessarily need to put on your body. Suki, was there anything else you had to add to that, or anything else you can come up with, bad habits?
Yeah, so I think you covered basically most of the modern living habits that can contribute to the diagnoses. One of the things I did want to mention with exercise is that in addition to the overwork on the physical body, it actually does affect your hormones as well. So if you over-exercise, you're actually increasing your stress hormones or cortisol that may cause an imbalance of basically a lot of things in your body, because there's such a huge stress component and interconnectivity with everything else in the body. So yeah, I just wanted to mention that as well, the hormone aspect of over exercising.
Thank you both so much.
Oh, I just see actually Liz had a question. I'm not sure who we're
okay, this is something I would have asked as well. Thank you, Liz, for doing that. What about decaf coffee? Can I do it? Can I not?
Yeah, so it's actually mainly just the caffeine, which is what affects us. So thumbs up for decaf.
Amazing. Okay, perfect. That was spoken very eloquently from both of you. Now I kind of want to go directly and dive into the common myths, what Dr. Google has to say about PCOS. Do I have it? Do I not? I'm going to let Dr. Arlene kind of ask that.
Okay, yeah. So Dr. Suki and I did our little Google run through, as she mentioned earlier. So my first question to you, Dr. Suki, is, well, this is a myth. So the myth that you are busting now is you must have irregular periods to have PCOS.
So it's funny because I think the first two myths can be quite easily debunked, because as I mentioned at the beginning, with the criterias, we need 2 out of the 3 things to be diagnosed, and having an irregular period is one of them. So if you have the other 2, technically you don't really have to have an irregular period to be diagnosed with PCOS. So with that being said, I did want to define what a normal period is versus an irregular period. So with a normal period, typically we see a cycle that is between 21 to 35 days, and bleeding lasts for about 3 to 7 days. So that's what we consider normal. And when we have irregular periods, that's when it is either longer than 35 days, you're bleeding for longer than 7 days, or you're missing cycles, or you're having like varying lengths, meaning that one cycle it's 15 days, the next cycle is 45 days. So that is what we would be considering irregular menstrual periods. So again, because it is only one of the 3 criterias, technically you don't really have to have an irregular period to be diagnosed with PCOS.
Amazing. Debunked.
Yeah.
Good night, everybody. Just kidding.
So, the second myth that we have is you must have cysts on your ovaries to have PCOS. What are your thoughts, Arlene?
So it's interesting to note that I think we probably would have touched on this later, but the terminology of polycystic ovarian syndrome is a little bit misleading, because it's not actually cysts that are on your ovaries, but immature follicles that we might see. So because there's many, it could have the appearance of cysts, but the follicles, they're generally not cysts. So the reason that this happens, first of all, that we get that increased immature follicle development is because there's hormonal signaling from our brain, and it increases androgen, so that male type hormone production in our ovaries, and it stops the development of the follicle. So normally the follicle develops and releases an egg for ovulation. But when we have that dysregulation of hormonal signaling from the brain, it stops it before it's able to release the egg. So that can happen in most cases of PCOS, but in some of them, we have one type of PCOS, which is called cyst-free. So these individuals who have that cyst-free type of PCOS usually have that delayed or absent ovulation. They usually have the symptoms of hyperandrogenism. So you could have that facial hair growth, as well as male pattern hair loss. And then you can also have metabolic features. So that means your lipid parameters are increased. You could have blood sugar dysregulation, but not necessarily polycystic ovaries. So the non-cyst type generally occurs in about 11% of people. So it happens, but in the grand scheme of things, not often with people with PCOS.
PCOS kind of has just a better ring to it than
PFOS.
The immature follicle ovarian syndrome.
Totally.
Yeah. As PCOS in itself is not already a mouthful.
Mm-hmm. I know. So, Suki, is it true that you can't get PCOS if you are lean?
So we already touched upon that a little bit earlier. Obviously, since it's on the list, it will be debunked, meaning that it is false. So as I mentioned at the beginning, with PCOS, there is the association with things like insulin resistance, association with diabetes, obesity, dysregulation of cholesterol. So because of that, there is that common misconception of, oh, if you have PCOS, you probably are going to be overweight. But not unfortunately, but this is false, because just because someone is lean, that doesn't exclude them from the diagnoses. So I know personally, for me, I was diagnosed with PCOS when I was younger. Now it is well managed, so yay. But yeah, it is definitely not something that would exclude you from getting the diagnosis.
Totally. And as we mentioned earlier, often it's undiagnosed because we don't typically think of leaner people as people that have PCOS. So it's interesting. And I'm glad it's been debunked.
Yeah. So definitely leads to underdiagnosis, like you said.
Okay. Sorry. I'm like typing fiercely because I want to make a poll for all y'all to answer, and let me just, I think it is online. So if you just click below the chat there where it says polls, go ahead. There are some pharmaceutical products available. Do you think the only options are birth control, metformin, or these aren't the only option?
So this poll does relate to the next myth, is that with PCOS, your only options are birth control pills and metformin.
Which has been the case for quite a few people, right? We are getting some answers coming in. People have chosen birth control.
Yeah, so I'm going to go ahead and start talking about it as you guys put your votes in. So, although birth control and metformin are commonly prescribed for people with PCOS, they are not the only option. But I will talk about why you might get put on a birth control pill and why you might get put on metformin. So the reason that you're put on a birth control pill is to kind of help mimic a period for those of us who don't get it or have long gaps in between, because you could have a lot of buildup of the lining of your uterus, and they just want to make sure that it's shedding properly. But it's essentially just mimicking those hormones in your body. And then for metformin, that is more so to control blood sugar regulation. So like we were mentioning before, that's one of the common things that we see with PCOS is poor blood sugar and insulin management. However, it's interesting to know that with metformin, it decreases the function of our mitochondria. And if all of us took grade 10 biology, we would know that the mitochondria is the powerhouse of the cell, which means that it's responsible for cellular energy. And the reason that this is important to know is because it can decrease our egg quality and actually lessen fertility outcomes in the long run. So, those are not our only options. We also have naturopathic treatments. Although Dr. Suki and I won't be talking about supplements and herbs today, there are definitely options, but we will be talking about lifestyle and nutritional things that you can include.
Mm-hmm. I just want to add one thing as well, because a lot of people are kind of put on birth control without really knowing the root cause, right? Or trying to figure out further. So, I have friends who are who since the age of 15 and now, they're 28, 29, 30, have been on birth control for like 13 years and their body still has no idea how to regulate its own hormones. And that is kind of risky in my mind, is it not?
Yeah. And I'm sure you guys also saw this quote by Aviva Romm, which said that a lot of the time when you see a person who isn't getting their period regularly, the first go-to is to put them on a birth control pill, because either I've heard this a lot too, even when I was diagnosed with PCOS, was that, it's normal. It's normal not to get it often when you're young. It'll just normalize itself over time, but here's a birth control pill for you to go on. So it is very concerning, especially if you decide to stop it and you want to try to conceive, right? Aviva Romm, going back to that, was saying that 1 in 10 people have PCOS, but you don't know because they were just put on the birth control pill.
Thanks for that. Yeah, there is something to be said for that, and why so many of us have just been put on the birth control pill without knowing why,
Yeah, and I think that is the common theme with a lot of Western medicine, not trying to, say Western medicine is bad and everything, but it is more about quick fixes, especially as a teenager, if we have acne, we are not getting our periods properly, we probably didn't have the patience to be like, hey, okay, let's try all these lifestyle habit changes. Nutritional changes. They're just like, no, just give me something that's quick. I don't want this acne because, teenage years are hard, So birth control pills were definitely like, okay, you tell me the risk. Sure. I don't really care about it. Not really listening to it. I'm just going to take it because it works.
And not only that, but it was like, I don't know if you guys experienced this, but as a young woman, it was like a lot of my friends were on the birth control pill. So it was like, okay, this is common. It's common to be on it. So might as well.
But we know that just because it's common
doesn't mean it's normal.
Got it. Thank you for that. Okay, let's debunk our next myth, shall we?
The myth for you, Suki, is you can't get pregnant or you have a higher risk of miscarriages if you have PCOS.
I think this is probably one of the most important ones, or the more concerning ones, for individuals with PCOS, because there's a lot of misconception that like, oh yes, you can't get pregnant, like you won't be able to have a child with PCOS. So I'm happy to tell you that this is not true. I think like the fear around fertility is because of like having these cysts on the ovaries will affect your reproductive potential. And same thing with like having irregular periods. We know that we get our period because we didn't get it's because we didn't get pregnant. Our eggs, we're not implanted. And when we have irregular periods, that means that we are ovulating irregularly, which decreases your chances of getting pregnant. Although those are true in terms of decreased chances of getting pregnant, that doesn't mean that you are unable to. So I think it is very important to know for individuals with PCOS or individuals who know someone with PCOS that just because you have the diagnosis, it doesn't mean it cannot be managed, it cannot improve, and you can't get pregnant. And that's where, like naturopathic medicine really comes in. We try to address basically all the different aspects of PCOS, whether this is the hormonal imbalance that is causing the issue, insulin resistance. So if we're able to tackle those areas, we can help decrease those symptoms, regulate your period, like do all the things that we can to support your body and support the fertility or reproductive potential. Then there is definitely a potential for you to get pregnant. And I think that's very important to know, because I know a lot of people who get diagnosed, they're like, oh my God, like, I don't know if I'll ever get a kid now. So yeah, just something to remember.
Yay, that is uplifting. There is a lot of good in the world as well. There's hope.
There is hope indeed. The next myth I have for you, Dr. Arlene, is PCOS can't be cured.
So I'm just going to breeze right through this one and tell you that that is false, because as even Suki mentioned herself, she is now thriving. I also have PCOS and I feel as though I am thriving. So it's really all about your management of it. And hopefully the whole goal of this webinar was to empower you to feel like you can manage it with the appropriate support and outlets. You also can thrive with PCOS.
Mm-hmm. Yeah. And I think I wanted to add into that is kind of tying back to the criterias that you need for the diagnoses. So if you're able to manage your hormones or you're able to regulate your period, even if you just do one out of the two, technically, you don't have those criterias anymore. So whether or not you're even eligible for the diagnoses, you're probably, you don't fall into that category. Mm-hmm. So I think this diagnosis in general with PCOS is definitely an interesting one, because it's like you can kind of like add the criteria back in. It's like, oh, you have this. Oh, wait, now you don't. Oh, wait, you do now. So,
yeah. Okay, so this is an interesting one that we Googled.
Wait. I actually made a poll for this one, for the next one. So I asked the people while you guys were talking if they think PCOS is dangerous. And I think everyone has answered by now. Mixed bag. There's more no's, but for a second there, the yes was winning. So is PCOS dangerous? What's going on here?
Yeah, so I think this was one of the questions or myths that surprised me the most. I don't know if it surprised Arlene as much as it did to me. But personally for me, I've never heard someone say like, oh yeah, PCOS is dangerous. And I'm wondering where that is coming from. So I feel like with my debunking, there is a little bit of like a guesswork around it. So I am going to say PCOS is not a life-threatening condition. So it's not dangerous in that way. I am speculating that people may think it is dangerous because of the cysts that exist in the ovaries, and that it may have the potential to erupt. This is where my guesswork is coming in, because I don't know exactly what people are thinking in terms of why it's dangerous. So like what Dr. Arlene has mentioned before with the misguiding terminology of the diagnoses, polycystic ovarian syndrome, technically they're not true cysts. They're actually immature follicles in our ovaries. Individuals are born with immature follicles. I feel like I'm saying that word a lot. But yeah, we're born with them. It's just that with the condition, they're not maturing or growing in a way that it should. So with that being said, they don't have the same potential to erupt as like maybe a true cyst might.
Mm.
So yeah, I thought that was an interesting myth for sure, but we thought it was still important to address in case people do think that it is dangerous or life-threatening in any way.
Yeah, and also because, other cysts can occur in the human body. And so when people hear the word cyst, they think, the first thing they think of is, oh, it has potential to erupt.
Mm-hmm.
And that can be really dangerous, in other conditions. So just to reiterate, Dr. Suki, you're saying that it's okay to have immature follicles and to have many of them, perhaps?
Well, I feel like the term okay is debatable. It's
right.
normal because, like it's supposed to, throughout a woman's lifetime, the immature follicles are supposed to either grow, mature, have your egg released, get pregnant or don't get pregnant. And, like throughout your lifetime, this keeps happening until you don't have any left or very few and you reach menopause.
Mm.
So yeah, we're all born with them. So I guess maybe that's what you mean by being normal. So yeah, does that answer that question?
Yeah, I'm just trying to poke at it a little bit and see what happens.
Okay.
Figuratively speaking.
Okay. Not actually.
Oh, thanks for that, though. On to our next couple myths. This is, edge of your seat, can't wait material.
Mm-hmm.
What is the next myth that we want to debunk?
Yes. So with PCOS, you're supposed to avoid all carbs and fruits.
Yes. So this is a question that I get asked a lot because we think carbs are bad with PCOS, but it depends on the type of carbohydrate. So if we're talking about those simple carbs, as I was mentioning earlier, like the pastas, the breads, the sweet treats, those ones aren't necessarily the greatest. But if we're talking about fruit, specifically fruit that are lower in terms of glycemic index and load, then that's okay. So that would be like your berries and fruits that are higher in antioxidants and fiber as well. So if you're making sure that you're including those fruits, vegetables, whole food sources of carbohydrates, then those are more than okay.
Perfect. And Dr. Arlene, speaking of Dr. Google, if someone types in, low glycemic foods, is that probably an okay source to look off of in terms of high or complex carbohydrates versus simple carbohydrates?
Yeah, that would be a good way to look at, I guess, to know what foods are better in terms of glycemic index and control. But also it does differ per person, because I would say if you have poorer blood sugar regulation, then you might have to cut out some of those foods that might appear on that list, because I think even whole grains and whole bread might appear. But yeah, so it just differs per person, but that would be a great place to start, Dr. Google.
Yeah, and our freebie at the end of the webinar will include a list of low glycemic index foods, or just like categorizing foods by their glycemic index. But what Arlene was mentioning, if you Google low glycemic index foods, most of the time the resources that pop up are more or less reliable. I will mention that sometimes there will be some varying differences with their glycemic index, only because there really isn't a true way of measuring the exact glycemic index. So there might be a little bit of differences, but overall they are relatively accurate.
Yes. Yeah. I wasn't sure if we were going to give away what was on our freebie, but now you know.
Sorry.
Well, it's called a freebie.
It's called a freebie. You're right. Okay. The last myth is PCOS a forever diagnosis?
So I feel like we also touched on this earlier, so we can answer this quite quickly. The answer is no. It doesn't have to be kind of like you're diagnosed with PCOS, so you will have to live with PCOS forever. I think this is what is tricky with the condition, is because it's a diagnosis of exclusion, and because it's so broad, just having the different criterias. If you no longer fulfill those criterias, technically, medically speaking, you probably don't have PCOS anymore. So again, just focusing on management, understanding the foundational treatments, it can help you manage your symptoms, and hopefully, I feel like this is not the right terminology to use to like get rid of the condition.
I often find, and this is the case for a lot of conditions, that there's a sense of war mentality, like it's us versus the condition, and that's not always the case, right? It's more about embracing, what we can do to help our bodies, and whether we have diagnosed conditions or not is really that's what it's all about, right? To just make sure you're eating right, make sure you're sleeping right, make sure you're doing the proper lifestyle techniques and really embracing your own life, versus kind of taking it from a victim kind of mode, a victim mentality. And so that kind of is a good segue, doctors, into the next part of our webinar, which is, what are some really good recommendations around the diagnosis of PCOS, and how can someone who either has PCOS or doesn't, how can they prevent it from getting worse or maybe getting PCOS at all?
Mm-hmm. So as Dr. Arlene mentioned at the beginning, in terms of just like the nutrition around what you're doing today that can impact your diagnoses, again, with our recommendations is to optimize your blood sugar regulation. Yeah, again, like PCOS is linked to insulin resistance, lipid dysregulation. I feel like I've said this many, many times. So with the nutritional recommendations, those will revolve around that association. So if we want to regulate our blood sugars, it is important for us to, choose complex carbs over refined carbohydrates, choose lower glycemic index foods, incorporate high fiber in our diet. Even things like, incorporating soy would be beneficial as well, because the phytoestrogens actually helps benefit our lipid parameters. It also can decrease some of our androgens and also benefit our blood sugar regulation as well. On top of that, we can even talk about omega-3s. Again, it helps benefit insulin, and it also benefits our lipids as well. Arlene also touched on anti-inflammatory things like berries, or lean proteins, things like that.
Mm-hmm. Some folks have some dietary concerns.
Mm-hmm.
Let's just kind of get through the next kind of recommendation, which is lifestyle, exercise, and then we can answer everyone's questions, just so the audience knows.
Okay. So again, I'm just going to be chatting quickly about some lifestyle recommendations that you can do. So first, I want to talk about exercise, and that is quite different per person. And essentially, exercise is to help prevent those long-term risks of type 2 diabetes, cardiovascular disease, mental health disorders. So actually, in a lot of the research, we see that high intensity interval training can be great for those of us who are trying to lose weight or help our cardiovascular parameters. So you can work your way up to about 20 to 45 minutes. But if you find that you're one of those people who works out and is completely exhausted afterwards, you can definitely start with even just 5 minutes a day as a great recommendation. Aside from that, we've seen that weight training, yoga, even walking can be helpful. Just any form of movement that you enjoy and you like to do is wonderful. So aside from exercise, I already touched on lowering environmental toxins. So in the form of glassware versus plastics, in the form of eating organic foods versus non-organic for those dirty dozen. And last but not least, Erin had mentioned this, and it's super important to keep in mind stress management as well as sleep regulation. So Dr. Suki was talking about some of the hormones. Our stress hormones can also affect our reproductive hormones. And one of those androgen type hormones is created a lot in our adrenal glands, which is where our stress hormone cortisol comes from. So that can affect our reproductive hormonal pathways and further produce androgens. So that's why we want to make sure that you're identifying your stressors and properly managing them in a way that works for you. And sleep quality over quantity. So making sure that you're sleeping at a routine time and hyping up your sleep hygiene routine. So sleeping in a nice dark room, turning off screens if you can, or using a blue light filter about an hour, if not more, before bed is wonderful to just help you feel recharged and regenerated.
Okay, so as the moderator, Mr. Burns style, I'm going to take a look through all these questions here, and beautiful questions, might I add. So let's start with Anvita's question. Again, thanks so much, both of you, for kind of just being here and educating us on all things PCOS and women's health. It was really a pleasure. So Anvita says, does someone with PCOS always have to cut off dairy and gluten?
Ooh, dairy is always an interesting topic. So with dairy, just based off of how it is created modern day, it is actually quite inflammatory. So with the association with like inflammation and PCOS, dairy can cause more inflammation in the body that may affect PCOS. So I feel like having the term always is always tricky. Like I never really want to be like, yep, you absolutely have to like take out all these things from your diet. But it is something to keep in mind, is that dairy is highly inflammatory for the body, whether or not you have PCOS, or you just have like general like joint pain or like other inflammatory diseases. Dairy itself can aggravate the condition. In terms of gluten, also an interesting topic. I feel like it can be a webinar in itself. But personally, for me in practice, I found that like gluten plays an important role if you are gluten sensitive. So if you find that gluten doesn't really bother you as much, then I personally wouldn't be like, okay, cut out gluten, because if it doesn't affect you, then I'm okay with you keeping in gluten. But something to keep in mind with that is that it goes back to like the low glycemic index food group. A lot of the things that may be higher in glycemic index might include gluten. So just kind of like cross-referencing that to see like where it lies. There are like lower gluten, low glycemic index foods. So just kind of like differentiating those to incorporate into your diet. I don't know if Arlene has anything else to add to that.
Yeah, so I will add on a little bit. You did a wonderful job of explaining that. So dairy actually is one of those foods that's higher insulin producing. So if you are taking a look at your blood work and you see, okay, my fasting insulin is quite high, or I'm not absorbing my sugar in my blood as quickly as possible, dairy could be a contributing factor to that. And it's actually one of the foods that I ask a lot of my acne patients to cut out, because it does increase insulin. Insulin can increase those androgen / male type hormones, and we can see greater oil production, especially in certain areas of our face. So that's why dairy is one of the ones that we often flag for people who are noticing that higher level of inflammation.
Great. And Vita, thank you so much for asking that question. I hope we did an okay job of answering it. If we haven't, please feel free to ask again, or maybe something more narrow. Taylor asks, would someone with PCOS want to reduce the amount of eggs that they eat?
Yes, this is a good question. I'm going to hop on this one. So eggs are, I think it depends for the person, because eggs are an amazing source of protein. Although if you do have, again, if you're looking at blood work and you're seeing that your cholesterol parameters are a little wacky, you may not want to be eating so many eggs in one day. Also interesting to note is that in Chinese medicine, PCOS is a diagnosis where there's a lot of dampness. And eggs are a damp producing food. So if you're eating eggs frequently and you're noticing signs of dampness, which would be things like sticky stools, a lot of acne, then perhaps eggs might not be the best for you.
I think it's also kind of like on a case-by-case basis, right? Especially, and that's a very specific question, which is good. So yeah, if you're having patients that, have a really high diet in eggs, maybe even consider changing the type of eggs, even to duck eggs or something like that. Might change a patient's lipid profile.
Totally.
There's always a common theme with a lot of things that we say. It's like, it's always case by case. It's always like based on the individual. And that's what we kind of like pride ourselves in doing, is that we are treating the individual. So it's not always the same treatment for everyone with PCOS. It really targets your specific concerns and your specific treatment goals.
Great. Amanda has a question. She's asking, what's usually the first concern that gets brought forth before a PCOS diagnosis?
I think for my personal practice, the first things that do come up, because it's more obvious, is irregular periods and acne, because those are so prominent and it affects the individual more than, say, like having cysts on the ovaries, because you physically cannot see that. Those are usually the first concerns or the first flags that come up. It's like, okay, if you have acne, you have irregular period, let's think of PCOS. But before saying that you have PCOS, we'll do like the transvaginal ultrasound, try to rule out everything else by doing lab work before we say like, yes, you have PCOS. But those are the two main concerns that do come up because it is so obvious for the individual.
Yep,
Anything
that's awesome.
to add?
No, you hit the nail right on the head. That's mostly what I see in practice as well, is a lot of people come in with missed or irregular periods.
Perfect. And we have one more question. Please, of course, anybody still listening, thank you. Yeah, nice. Thank you for keeping in tune until now. I know it's been an hour and 8 minutes, so thank you. You are all amazing. Any more questions, though, please ask away. We have like 2 more hours left in this room before it expires. Like I'm here all night. So yeah, Liz is asking, should you be concerned about over-exercising? Because I know we mentioned under-exercising.
Yeah, so I'm not sure, I hope I touched on this earlier, but perhaps I did not. So over-exercising is definitely can play a key role as well in one of those things that we might be doing that contributes to our diagnosis. So over-exercising is one of those things where it could help build more inflammation and create more stress on your body. And I think actually Dr. Suki touched on this when you're over-exercising or you're just creating more stress, your cortisol can affect your reproductive hormones and how they flow in your body and how they affect your menstrual cycle. So definitely over-exercising can play a role.
Anything to add, Dr. Suki?
No, I think we did touch on it at not really the beginning, but I guess the first half of the talk. It's mainly over-exercising can exhaust your body, create more stress on the body that can impact how your body heals. So again, going back to the hormones and the interconnectivity with stress hormones and the androgens and things like that. So definitely kind of gauge where your body is at. If you find that you're exhausted after a workout, scale it back a little bit and see how you feel. And yeah, over exercising is definitely something that we do always like to address with individuals as well, just to make sure that they're not like pushing it too hard or pushing your body too hard. That doesn't allow for the proper healing or the rebalancing of the body.
Good stuff. Yeah, I know just from a personal trainer perspective, I used to monitor people's heart rate variability, which basically they do it every morning. Then you have a baseline. They wake up one morning, you know, maybe the day before they had a really hard workout. They wake up one morning and, you know, the heart rate variability says it's very high, which is very low. And so, you know, people can use heart rate variability as well to kind of gauge how you know, prepared or how rested the body is for exercising.
That's interesting.
Yeah, so there's lots of different ways. Thank you again. It looks like there are no more questions. Oh, no, there is. Sorry, I lied. Okay, we have another question. I love it. Keep it up. Okay, question. What if you only have one of the criteria and still have PCOS? In this person's case, she has only irregular periods. That's it.
So I guess, sorry.
No, go ahead.
I guess my question is, what makes you think you have PCOS if you only have the one criteria? I know, like, definitely type in the chat to answer, because I know you can't physically talk in the webinar, I don't think.
You can also type it privately to us if you feel more comfortable that way.
Yeah. Yeah, so with irregular periods, I feel like with just that, there are so many reasons that you may have irregular periods. Like, if you're stressed, your body may not, sorry, I just saw the window popped up.
Oh, it's all good.
I've been diagnosed. Thanks for asking. You guys are great.
So yeah, she says I've actually been diagnosed with PCOS. That's how she knows, I guess.
Okay. So were you diagnosed just based on the irregular? And now I feel like I'm just doing like a consult right now.
Honestly, yeah, I think maybe the practitioner, again, maybe took a guess. Not to say that your practitioner is wrong in that guess. But yeah, those are the criteria that we mentioned earlier. So
yeah, and like we said, it's a diagnosis of exclusion too, right? So if everything else was ruled out in this case, then perhaps that was the next step. But it would be interesting to see what the blood work looks like, because that could also give us an indication, just aside from looking at you clinically and symptomatically.
And again, like, always relating back to the three criterias, irregular periods, higher androgens, whether this is through lab work or symptoms, and the transvaginal ultrasound to observe your ovaries. So if they have done all of that, and there were no cysts on the ovaries, your testosterone or your androgens are normal, but you only have irregular periods, I feel like this is where naturopathic doctors kind of like does really well in, is to address all the other lifestyle factors. Because again, like I mentioned, irregular periods can happen to a lot of people, not because of PCOS, but even like simply from like stress. If your body is stressed or chronically stressed, it's less likely that your body wants to get pregnant. So it's like, okay, like, I'm stressed. I don't have the resources right now for you to grow another human being in you. So you're not going to get your period. So yeah, it really is about ruling out everything else. So it's definitely interesting to hear, Liz, that you were diagnosed with PCOS, even though you only had the one criteria. So again, because this is a webinar, we can't really like specifically address things or like make any recommendations, but I do hope that just knowing that those criteria are there and that there are other potential reasons for why you're missing your period that you may be able to like look into as like an alternative to a PCOS diagnosis.
Mm-hmm. Yeah, and even just exactly what Dr. Suki said, hopefully our webinar brought to light some of the things that could be contributing to irregular periods in general. So we see a lot of the time people who are under eating or over exercising, people that are training for marathons might not necessarily get their periods regularly. And I know for a lot of folks, even just quarantine and COVID, having that change of routine affected their menstrual cycles.
Mm-hmm.
So yeah, so stress also can play a role. So it's definitely food for thought.
Mm-hmm.
Of course. Yeah, those are really great questions. And it's nice to see that, you know, Liz, just for you as an example, that you're really taking your own initiative to learn more about this diagnosis that you have. And, you know, maybe looking forward to working with other practitioners, trying to get the fuller kind of picture might be a good idea for folks on the call right now. But that looks like it's the last of the questions. I am so happy, so proud of both of you for coming on here and really entertaining us and giving us some solid feedback, some solid educational advice. And I know I learned a thing or two about PCOS, even though, you know, I learned about it too in school. So I can't thank you enough. I'll leave a little bit of space here now for maybe you guys both to just let everyone know, let the audience know how they can maybe contact you, maybe further do some work with you. Maybe exactly reiterate where the location of the clinic is again and all that.
Yeah. So both Dr. Arlene and I are at the Herbal Clinic and Dispensary, which is on Ronces. So kind of like, I think the main intersection is actually like Dundas and Ronces, so just kind of like at the end of it. So we're both available there for in-person and online consults. So you can find us through our website. So in our freebie, there will be a link for our websites and where to book if any of you folks are interested in working with us. And you can reach us there. And if you have any questions, definitely feel free to like email us in terms of like fees or like the process of naturopathic consults, because I know a lot of people are curious about that. It's not as transparent as say like a walk-in clinic or anything like that. So yeah, definitely refer to our freebie for more information. Yeah, I don't know if you have anything else to add.
No, I mean, that was about it. But of course, thank you, Erin and Kween Wellness, for having both of us. I know I had a good time, and you always facilitate an awesome discussion. And yeah, just exactly what Suki said. And if you're just interested in naturopathic medicine but don't know where to start, both Suki and I do offer free meet and greet sessions, which is just like a 15-minute consult to get to know us and just chat about if we think would be a good fit for a therapeutic relationship.
Yeah, I'm going to actually just type both of your Instagram handles into the chat so folks know exactly how to spell your names, etc.
Perfect.
And yeah, I can't reiterate enough how amazing it is to host good people with good vibes, good participants, great audience. Again, Kween Wellness is happy to facilitate that. So thank you, audience, again, for being here, for tuning in. We've had an all-time record high participation. So far, so good. So let's keep it going. And again, I actually added the bonus as a file into this webinar. I'm not sure how it looks on the participant screen, but it should be down below the chat, the polls. There's a little tab called Files. And if not, don't fret. The replay will be in your inbox again tomorrow. basically in about 24 hours, you'll get the replay and you'll get that amazing blood sugar regulation freebie that both Dr. Arlene and Dr. Suki have made specifically for this webinar. So thank you again. Here's to many more webinars.
Yay!
Yes, we're here.
I am loving this platform. So
good. Thanks for the feedback. Amazing. Okay, ladies, thanks again. We'll see everybody really soon.
All right. Thank you
Thank
so much.
you.
Have a wonderful night, everyone. Thanks for tuning in.
Yes, thank you, everyone. Good night.
Bye.